All right, the last formed element is your platelets, also called thrombocytes. And so that's talking about the same thing. So it is good to learn both names that you might see for platelets. I'm not a big fan of calling them thrombocytes because they're not cells. Okay, they do have a membrane, but they don't have anything else as far as your internal cellular structures. They don't have organelles or nucleus or anything like that. They're little pieces of cells, and when you see them on a microscope slide, they are, you can tell they're just little specks. They're just little pieces. They're not a cell. But thrombocytes is another name that you'll hear for it. Now, there's a cell in the bone marrow called megakaryocytes, and so if those megakaryocytes aren't being produced correctly, or if they're having abnormalities in their function, then it could affect your platelet levels. They play an important role in blood clotting. So when you don't have proper platelet production, that causes issues with the ability to clot blood, and that'll come into play in this video a little bit later. And there's their numbers right there, which those of you guys that are going into medical lab technology, that's numbers that you're expected to know. How many platelets, what's considered normal platelet levels in a microliter or cubic millimeter of blood, which is basically a small drop. You're looking at about 150,000 to 400,000 platelets. Now, just like your red blood cells, platelets don't live very long. Okay, in fact, they live a lot. They have a much shorter lifespan than even red blood cells. Red blood cells can't repair themselves; they age very quickly, and they have to be removed by the liver and the spleen. Platelets are the same way. Okay, platelets they don't have a chance. They're just little pieces of cells. So they, at least with red blood cells, they're large enough to tolerate some damage before they wear out. Where platelets, they age extremely quickly. They don't work for very long, and they have to be removed from circulation. So the typical lifespan of a platelet is about a week to 10 days. That's it. And then they're going to get removed by the liver and spleen again. So the spleen especially, the spleen will bring them in, break them down, and store them away if necessary, to use again if they're not, or possibly help to sort of create new ones. But once they do their job, after a week or two, if they're not used, then the spleen will remove them and store them, and that way release it back when we possibly might need it. If the platelet is damaged to a point where it doesn't work anymore, then it's going to get replaced by new fresh platelets. And there's a hormone that stimulates that called thrombopoietin, okay, just like EPO, erythropoietin. There's a hormone called thrombopoietin, which stimulates platelet production. So you make them, they float around, then they eventually get removed and replaced with new fresh platelets. So you're constantly doing that, just like you're constantly removing and replacing your red blood cells. And a lot of times with your white blood cells, they get used up and you have to replace them. Remember that blood is sort of constantly getting replaced as you either use the components or the components grow old and they have to be removed for the sake of the body. They're just not working as well. Now, on this blood smear right here, it doesn't have a white blood cell on it, okay? But white blood cells are the largest of your formed elements, so they kind of dwarf. Actually, if you go back to these pictures here, you can see that white blood cells are bigger than red blood cells, okay? Just a little bit in some cases, but they are bigger. So white blood cells are the largest formed element. Then you got your red blood cells, and then the little purple specks on a blood smear is your platelets. So you can see they're like these little pieces of cells that are sort of in that sea of red blood cells there. Their job is to initiate blood clots. Okay, when you have a vascular injury, so blood's normally supposed to be fluid. All right, and what it comes down to, I'm gonna draw a little picture here. Is imagine this is your blood vessel, and then you're gonna have like the outer wall. So you're gonna have the wall of the blood vessel, like hang on. Got a little off kilter there. Okay, so here's your blood vessel and the two walls. Okay, so here's the lumen, here's the inside, that's where blood is. And then you have the wall of the blood vessel, and you have the wall of the blood vessel there because it's a tube. Okay, Now, in the wall of the blood vessel is collagen. So let's put some collagen in here. So you're going to have collagen there, and you're going to have collagen bundles here. Collagen is a protein that you find all over the body, and it's used to help provide strength to a particular tissue. Then you got to put an epithelial tissue. So let's make it red. Okay, lining the inside wall of your blood vessels is a type of epithelial tissue. It consists of one layer of flattened cells. All right, so you're going to have one there, and then this wall up here is also going to be covered by a layer of simple. Okay, remember from AMP1, when you have one layer, it's called simple, and if it's flat cells, the word we use is squamous. So you got simple squamous epithelium lining both walls of a blood vessel, and they actually have a special name for it. It's called endothelium. So endothelium is the inside lining of your blood vessels. And you hear that word sometimes, they'll say endothelium or endothelial lining. Okay, that's the inside wall of a tube. And so here, this is called endothelium, here and there. All right. Now, as long as that endothelial lining is intact, platelets, so let's draw platelets in here. Okay, platelets will just travel on through and not do anything because there's no problem. And so as long as the epithelial lining, as long as the endothelium is intact, then platelets don't do anything. They don't cause a blood clot. Now, when you get a vascular injury, that's when you lose part of your endothelial lining. So let's just use that for an example. Okay. So when you get a vascular injury, you might get the loss of your endothelial lining, and that exposes the collagen underneath. Okay. That's where platelets come into play. So I'm going to keep that picture up for a second. So just keep in mind that, as long as that endothelial lining, let's draw it back in there again. As long as that lining's intact, nothing's going to happen. Then you get a break in the blood vessel wall, and that's when you get what's called hemostasis. Hemostasis is a fancy word for blood clot formation. It's basically the stopping of bleeding. It means blood stable. Basically, it's saying, or unchanging blood. You basically stop blood loss. Okay, stasis means stable. So to stop blood loss, you usually want your blood to be fluid, but when you have to form blood clot, then you're going to have something occur. And actually, blood clotting itself, the story of blood clotting is extremely complicated. I'm not going to have you guys to learn every single step. You're going to learn the basics. Okay, if you want to go into learning more, you can. There's books out there and videos and stuff. But I have a book where it spends a whole chapter talking about blood clotting, and if you read it, it'll make your head spin. It talks about every possible enzyme that's involved, every possible substance. I mean, there's over 30 different substances that have to be there in the correct amounts and be able to do their job in order for a blood clot to form. You've got calcium has to be there, vitamin K has to be there, a bunch of clotting factors have to be there. And it's just, it can make your head spin. There's dozens and dozens of steps when it comes to the actual clotting of blood in that metabolic pathway. You guys just have to learn the three major steps and what is going on. Okay. So the first thing that happens when you get a vascular injury is you're going to get what's called a vascular spasm. That's a very powerful and quick vasoconstriction of the blood vessel. And then what that's going to do is that's going to limit the blood loss. Okay. So vascular spasm is there first. That happens immediately. So as soon as you break a blood vessel wall, you're going to get that vascular spasm, and that's going to limit the loss of blood. It's going to shrink up the blood vessel. It's going to close the gap, so that way not as much blood is leaving out through the opening. It lasts for a few minutes, and then you get greater vasoconstriction when you get greater vessel damage. In fact, a lot of times if you sever a blood vessel, the spasm will cause the blood vessel to sort of shrink up really short and actually cause it to sort of shoot down or up into the body, For example, if you sever the femoral artery, a lot of times the femoral artery will retract back up into the leg, and so it's kind of like a rubber band. When you snip a rubber band, that elastic recoil, it kind of snaps apart, and you'll see it shrink up as it does its vascular spasm. Then you go into what's called platelet plug formation. Okay, so when you have a hole and you have a break in the blood vessel wall, that's when a platelet plug forms. Now, a platelet plug is not a clot. I always equate it to like when you have a hole in a bucket of water, or if you have a hole in the wall of a dam. Okay, a platelet plug would be like sticking your finger in the hole or sticking your finger on top of the hole. Okay, so yes, it will temporarily stop the blood loss, but once you remove your finger, then the water is going to come out of the bucket, right? So when you have imagine you have a hole in a bucket that's full of water. Water starts coming out. You can stick your finger over the hole and you can stop the water from coming out, but it doesn't actually fix the problem. It doesn't actually seal the hole. Okay, that's what a platelet plug is. It just plugs it. It just plugs the hole. All right. Now what happens is, we go to our picture over here, is you got your blood vessel wall. Okay, and then imagine that you get a vascular injury and the blood vessel wall is broken. Okay, so this is gone. Whoops, sorry. So imagine that that's gone. Let me draw my collagen back here. So you got a break in the blood vessel wall, and you've got collagen. Maybe you have a break right there in the collagen, right? And so there's a break in the blood vessel wall. Your platelets are floating around in the blood. As long as that wall is intact, they don't do anything. But now they're going to actually do something. Okay. Whenever you have that break in the blood vessel wall, in the endothelial lining, the platelets come down, and the platelets will start sticking to the collagen. So it sticks to the collagen in the underlying tissue, and the platelets will actually start sticking to each other. And we call that platelet aggregation. And so they're basically going to form a little plug by sticking to the collagen and then sticking to each other. And you're basically putting your finger in the hole to stop the loss. And that's a platelet plug. Okay. So I put in the notes there that blood vessels are lined with simple squamous epithelium. It's called endothelium. As long as that wall is intact, nothing happens. When the blood vessel is injured, collagen is exposed, and the platelets bind to the collagen, and that triggers blood clot formation. Okay, this is kind of like a red alert. Okay, in fact, you'll see here in a minute that platelets will start a blood clot when they come in contact with anything other than the endothelial lining. Okay, so that's what they're supposed to bump up against, is the endothelial lining. But if it's not there, they'll stick to something else and they'll start doing a blood clot. Now, there is a substance called von Willebrand factor, which helps platelets to stick together and stick to collagen. And there is a form of hemophilia out there where people have a defective von Willebrand factor, and it really affects their ability to form a platelet plug. And so it's a form of hemophilia. It's not as common as, say, hemophilia A and hemophilia B, but you will hear about defective von Willebrand factor, and it really messes up your ability to form the platelet plug. Then there's also medications that inhibit platelet plug formation or inhibit what we call platelet aggregation, and that's how aspirin and ibuprofen. That's what they do. And so both of those guys, one of the things you have to worry about when you take aspirin and ibuprofen is stomach bleeding and things like that, because it's going to prevent platelets from binding to collagen and binding together. So it basically inhibits platelet plug formation, and that's why some people take aspirin, to help prevent things like blood clots and heart attacks and strokes and stuff like that, is because it helps to sort of prevent blood clots from forming. There are other blood thinners that work differently. Okay, and we'll talk about those as we kind of go along. But when it comes to aspirin and ibuprofen, this is what they block. They inhibit platelet plug formation. And if you don't get platelet plug formation, then it doesn't progress to an actual blood clot. Now, once the platelets form the platelet plug, they start releasing signals, basically saying, we've got a problem here. Now, another thing floating around in your blood are these guys called clotting factors. And what platelets do is they release enzymes. One guy's called thromboxane, But basically, these enzymes will start switching on clotting factors. And that's the third step. So once the platelet plug is formed, the platelets will start um, releasing substances. And then eventually, what you're going to get is you're going to get the activation of a substance called fibrin. All right. Right now, you have floating around in your blood a guy called fibrinogen. But when you need to form a blood clot, fibrinogen gets converted into fibrin. Now, fibrin, remember I talked to you guys, if you put your finger in the hole, that's like a platelet plug. If you stick your finger over the hole. Fibrin is the seal. So fibrin will be what you actually use to seal the opening. So it's like the duct tape. It's what you put over the opening to actually seal it and fix it. And so a finger over the hole, a platelet plug is not going to fully fix the problem. You've got to seal it with some type of tape or some type of adhesive or whatever. You got to cover it up and then seal the actual opening to prevent the blood loss. So you put your finger in the hole with platelets, and then you actually seal the hole with the duct tape or the press-in seal or whatever. You actually seal the hole with fibrin. Now this is where it gets complicated with the blood clotting, because what happens is, and I've kind of put it there on number C. Listen to me, letter C. On number 27C, it says platelets will release enzymes that begin a cascade of activation of clotting factors. Okay, what that means is that one clotting factor will turn on another, and then that guy will turn on another clotting factor, and that guy will turn on another clotting factor. Okay, and so they call that a cascade, where you got one guy switching on another. Now they've numbered the clotting factors based on their discovery, and this is where it gets complicated too. You would think one switches on 2, and 2 switches on 3, and 3 switches on 4, and 4 switches on 5. That's not the case. This is where it can get really confusing. These clotting factors were numbered based on the order of their discovery. So what's interesting is the last clotting factor to be activated is number 1, because it was the first one to be discovered. And then the next to last guy is number 2. But it kind of goes all over the place. And I'm not going to ask you guys to learn this, okay? But you ought to see how crazy it gets. It can make your mind basically spin. But if you're looking here, look at platelets adhere to the blood vessel wall. So that's the platelet plug right here. There's the platelet plug. And they'll release a guy called clotting factor 12. Clotting factor will then turn on clotting factor 11. And then clotting factor 11 will turn on clotting factor 9. Clotting factor 9 will turn on clotting factor 8. And then clotting factor 8 turns on clotting factor 10. Okay, now they use Roman numerals. Okay, so you're going to see it like this. All right, this guy's going to be that. This guy's going to be this. And so if you don't know your Roman numerals, they're used a lot in science. At least know like 1 through 12 or 1 through 20 or even 1 through 100 or however else you got to do it. But this right here, they use the Roman numerals. When you see this, okay, that it's not clotting factor X. It's clotting factor 10, Roman numeral 10. That's the guy you need to get to, okay, is clotting factor 10. If you don't get the activation of 10, then the blood clot will not finish, because what he's going to do is he's going to switch on a guy called thrombin, and then thrombin switches on a guy called fibrin. And fibrin is the duct tape. Fibrin is the glue or the glue or the tape that you use to cover the actual hole. He's the sealer. Okay, platelet plug plus fibrin equals a blood clot. And so this is clotting factor 2, and this is clotting factor 1. And so you can see that the numbers don't go in order, and that's what makes it really complicated sometimes. But what you guys have to understand is that you got to get to him. You got to get to clotting factor 10. And if you don't, then you don't get to fibrin. And fibrin is your sealer. He's the guy who actually seals the opening. So that's the key there, okay? Now, this is where a lot of hemophilia comes in, because if you don't get to 10, you don't get a blood clot. If any of these other clotting factors are defective, then you're not going to get to 10. Just like you can't do step 10 until you do steps 1, 2, 3, 4, 5, 6, 7, 8, 9. All right. Now, the 2 most common forms of hemophilia is hemophilia A, which is a problem with clotting factor 8. So it's like you get almost to where you need to go, and this guy doesn't work, which means you never get, the whole process stops there, and you never get to 10. And so that's hemophilia A. Hemophilia B is a defective clotting factor 9. And so if you don't get this guy switched on, then this guy doesn't switch on, this guy doesn't get turned on, and neither of these two guys. So it stops right here. Okay. And that's the problem with hemophilia. You may begin to get a blood clot, but you're not going to get the sealer. You're not going to get fibrin activated. And so if anything messes up with you getting the clotting factor 10, that is going to cause your hemophilia. So I put number 28 there. It says, which clotting factor must be activated to finish a blood clot? That's number 10. Because if clotting factor 10 is not activated, then you don't get fibrin. And that means the blood clot is not going to finish. Okay? But believe me, it's a lot more complicated than that. Okay? And it also talks about some of the other things. If you go back to this previous slide here, it talks about some of the other things you need for clotting. Calcium. So if your calcium levels are messed up, that can mess up your ability to clot blood. If vitamin K is not at the proper levels, then that will also cause problems with producing a blood clot, because vitamin K is down here. Vitamin K is required to make clotting factors 2, 7, 9, and 10. Okay, is a vitamin K. You need vitamin K to make 10, the guy that you need to activate. And so that's why vitamin K is so important to blood clot formation, because you need him to make clotting factor 10. And in fact, there's a common blood thinner out there called warfarin or Coumadin. Warfarin's the brand name, and then Coumadin is the generic name. But that's what warfarin. That's how it stops blood clots. It's a vitamin K antagonist. That means it blocks the function of vitamin K. And so it basically stops your ability to clot blood, because you can't make the clotting factors that you're supposed to make. By the way, here's one of those crazy explanations for blood clotting. So that's how complicated. That's what it makes your head spin when you think about all the things that goes into clotting blood. And I think it makes sense if you think about it. You don't want blood to clot unless it absolutely is necessary. So by having this many steps and having this many things involved, it basically is a prevention mechanism so that blood doesn't clot when it's not supposed to. So you make it go through a bunch of red tape to get to the final point where you need to get. But the moral of the story is, you can see it here, is you need to get to clotting factor 10. Okay, once you get clotting factor 10 to activate, then thrombin is activated, and then fibrin is activated, and then you get your blood clot. That's the key. Okay, all these other guys are earlier in the story, but you got to get the 10 so you can get the fibrin, so you can get the blood clot. Okay. That's how warfarin blocks vitamin K, so you can't make clotting factor 10 the way you're supposed to. Warfarin was originally rat poison. It would cause the rat to bleed out when they ingested warfarin. It would cause them to have very thin blood, and whatever the next injury is, whatever the next cut they get, whether it be in their gums or wherever the next cut, it basically just makes them bleed out. So any kind of vascular injury. Now then you also have the guy you probably see on TV a lot, Xarelto. Xarelto. There we go. Xarelto's mechanism of action. Let's look at this. It's an inhibitor of clotting factor 10. So he basically blocks number 10. So no 10, no blood clot. Actually, I saw a little picture here that kind of talks about some of the issues. You got your Coumadin, which blocks the production of vitamin K, which blocks the activity of vitamin K, so you don't get 10. Xarelto blocks clotting factor 10A, the activated form, and then Pradaxa blocks thrombin. And so they all work to thin your blood, and they all work to prevent blood clots. It's just how they do it is a little bit different. Aspirin goes way back to your platelet plug, and then all these other guys kind of come into play at different parts of the story. But look at all the madness that goes along with blood clotting. So please be thankful that I'm not asking you to learn all of that. Okay. Now, there are some bleeding disorders. We talked about hemophilia. And so hemophilia is now this right here. This slide talks about what I was talking about earlier. How uh, blood will clot when it comes to contact with anything other than an intact blood vessel wall. So if you drew blood and put it in a glass tube, as soon as the blood hits the glass tube, it's going to start the blood clot. Okay, so that mentions it right here. Okay, blood will clot when it comes in contact with anything other than an intact blood vessel wall. So if you drew blood out and squirted it on the ground, it will clot. If blood comes out of your blood vessels and touches your skin, it will start to clot. Okay, but once again, whether it happens inside the blood vessels, which we call the intrinsic pathway, okay, or it happens outside the blood vessels, which we call the extrinsic pathway, it doesn't matter. You got to get the 10. That's the overall idea. You got to get the 10. So hemophilia is when you have an issue with any problem with getting to 10. Okay, so hemophilia in A and B is the most common. Now the genes for the clotting factor 9 and the clotting factor 8 is on the X chromosome, and so you typically see hemophilia is much more common in males because we only get one X chromosome. So if our X chromosome that we receive has a defective gene, then for those genes that the clotting factor 9 and clotting factor 8, if we have problems with those clotting factors, we're going to have hemophilia. Now, a female a lot of times she gets two X chromosomes. On one of the X chromosomes, she may have a bad gene, but on the other X chromosome, she has a good gene, and she's okay. Okay, she doesn't have the disorder. And so males exhibit the full-blown disease a lot of times, while females are typically carriers who then pass it on to their kids, their sons. So a lot of times you have the inheritance pattern from a mom who's a carrier. She doesn't have hemophilia, but she carries the bad gene, and then she gives it to a son who has hemophilia. And you see that a lot with X-linked disorders, where the mom doesn't have the condition, but she has the bad gene. She's a carrier, and then she passes that particular chromosome X onto her son. Penia, get used to that word, penia. That means poverty or lack of. Okay, poverty or lack of is what the suffix penia means. And so you see leukopenia, which is a lack of white blood cells. You see thrombocytopenia, which means a lack of platelets. Okay, so penia means poverty or lack of. And then whenever you have a low platelet count, that's going to affect your ability to clot blood. There we go. All right. Now, blood clots can also, both of these are problems with blood clotting. You can't clot blood. But then you have other situations where you have blood clot more often than it should, and they call that hypercoagulation. So hypercoagulation is an increased tendency for blood to clot, and that could be due to a lot of different factors. Okay, but a lot of times you'll get a blood, and we talk about this more when we talk about the blood vessels. Okay, but you'll get a clot form, and when it's stationary, it's called a thrombus. But sometimes a piece of that blood clot or the clot itself will detach and start traveling. And that's called an embolus. And what will happen is it'll get pumped to the lungs and it will clog up the pulmonary capillaries. Because remember that, capillaries are just wide enough to allow one red blood cell through. So if you get a clot coming in, it'll basically get to the capillary bed and just block the entrance of blood. It will clog up the capillary bed. And when that happens, that can lead to problems with breathing, and it can end up leading to death. So a pulmonary embolism is a very common domino effect of forming blood clots. You form the blood clot, and then it detaches and starts traveling, and eventually makes its way to your lungs, clogs up your lungs, and causes a pulmonary embolism. Also, blood clots could potentially cause heart attacks and strokes. The blood clots have to form in those areas for it to happen. So the most common thing that happens when you throw a blood clot is pulmonary embolism. But if a blood clot forms in the coronary veins, okay, the veins that drain blood from the heart, if you do get a clot to form there, then that can cause a heart attack. Or if you do get a clot to form in the brain, then that can cause a stroke up there. So pulmonary embolism is sort of like where a clot typically gets pumped to, because blood coming, we haven't talked about this yet, but blood coming back from the body gets pumped to the lungs. And so a blood clot causing heart attacks and strokes is a little bit less common than a blood clot causing a pulmonary embolism. And like I said, we'll talk about that a lot more when we get to blood vessels and the flow of blood and all that good stuff. All right, there you go. That's chapter 18. So watch these videos, take notes. If you have any questions, then we can talk about it in class next week.